It's World Immunization Week, and African countries are shining the spotlight on the importance of vaccination by celebrating African Vaccination Week. The annual event runs from April 24th to April 30th. The theme this year is Vaccines Protect Everyone, Get Vaccinated. Africa 54's health correspondent Linord Moudou spoke to Dr. Ayo Ajayi. He's the director of the Africa team at the Bill and Melinda Gates Foundation. She asked him about the significance of African Vaccination Week.
African Vaccination Week is a way of getting high-level political consciousness and leadership on making sure that African children get access to vaccines for diseases that we know how to prevent. It's a way of reminding Africans that we're not there yet, that we need to do more to make sure that we vaccinate our children, to make sure that we enable them to survive diseases that we already are able to prevent.
This is critical because the statistics say across Africa, 1 in 5 African children do not have access to the basic vaccines that could prevent child mortality. What do you make of this? We're
not committed enough. Because, the benefits and the impact and the effectiveness of vaccines are not controversial at all. What's even more incredible is the fact that as a preventive measure, it's the most cost-efficient investment that any government can make. Because $1 that you invest in childhood vaccinations returns $44 in economic and social benefits. I mean, that's compelling.
So tell us, what are some of the barriers to vaccination on the continent?
We talked a little bit about the political commitment and the leadership. Then we'll have to talk about the funding. In many of these countries, the governments, they are not able to afford it completely. That's the role that Gavi was set up to fill. Some countries are going to be starting to graduate from Gavi. For those, it's particularly important to make sure that the domestic resources are available to fill the gap that's going to be left. So you've got funding, you've got political commitment, you've got the health systems in the country. You can only go so far as to the weakest link in the health systems. And in many countries, the health systems are quite fragmented and not as effective as they should be, which is why, we still have to resort to campaigns in some instances.
Do you see a shift in leaders' behavior in terms of how much they see the importance of vaccination?
But the consciousness is there already. I think you remember that a year ago, here in Addis, they got together to make pronouncements during the vaccination week when they promised to support universal access to immunization through what is now called the Addis Ababa Declaration. The energy and the effort to get to this kind of a declaration is important. But what's more important is what happens after that. And I think that's where more political will is important.
You talked about the Addis Declaration on Immunization, and it includes 10 commitments and 4 calls to action. And it was endorsed by head of states on 31st of January this year. Where do we go from here?
The population have to demand some of these services and bring their leadership to account. This has got to be a push and pull. The governments are committed, the political leadership are committed, but there's a lot of competing demands on their resources. And if no one is watching, they will skip this one too. And that happens from time to time. What we would need really is a ground movement that really, in each country, that makes sure that this is in every budget. Their vaccine coverage programs is fully funded, and that whatever assistance they need in strengthening the systems for delivery to reach the most excluded people is also put into place.
Let me have your final thoughts in terms of how you foresee the future to have a greater impact in the work that you do with the Bill and Melinda Gates Foundation.
I think the importance of this week of vaccination is, for me, is twofold. One is simply that for the diseases that we have prevention for, we should embrace them fully. There are new diseases that are emerging that we don't even yet know which way they're going to go. The stronger our health systems, the better coverage we have for vaccines that we have today, the easier it will be for us to address coming tragedies. And there will be some. We expect them. It's not a matter of if, it's a matter of when. And so we feel that the importance of building a very robust primary system in the country that's able to deliver vaccines to even the hardest to reach corners is essential for what we're going to be facing going forward. But I'm very optimistic that we've made a huge progress. A lot of the basic principles are known. We know how to do it. We know how to start to mobilize the political will and the commitment to it. We've figured out some architecture to provide funding for the countries that are hard-pressed to, provide coverage. We have to continue to do these things. The future is uncertain, but we do know that we're starting to see so many different and new emerging diseases. We need to be much more effective with the ones that we know how to deal with.
Dr. Ayo Ajayi, thank you so much for joining us today.
Thank you.